Well, today we have a lot of diabetes medication, and this is the result of recent advance in the research in the field of diabetes. But sometimes it can get too complicated, and many a time your doctor may not have the time to explain why you are prescribed those medications and what are the major side effects of this medicine. I'm going to make two videos on the details about diabetic medication. And the first video will be on the basic principle about how our body handles blood sugar. How blood sugar is controlled within an optimum level, because that's the principle of most of the medication we use nowadays. And I think in the first video, I will also discuss two of the major traditional medication for diabetes. For the rest of the diabetic medication, I will leave it in the second video. So the first thing you have to know is that if there is excessive amount of sugar, the body can convert the blood sugar into a storage form in our liver. When there is a need for more sugar in the blood, then the body can extract sugar from the liver to maintain an optimal level of glucose in our blood. Next, I'm going to discuss three hormones. The first one, I'm sure all of you has heard about, is insulin. It's very simple. If we take in some food which contain carbohydrate, it is broken down and absorbed through our gut into the blood and become our blood glucose. It follows that when we eat something, our blood sugar is bound to rise up. As I said many times before, everything in the body is in a certain equilibrium. We don't normally want a substance to be too high or too low. Same principle about your blood glucose. We don't want blood sugars to go up too high after eating. So when we eat something, the blood glucose go up, our pancreas will release insulin. This insulin will help to move the blood sugar into our tissue, for example, into our muscle cells. And when the blood sugar is moved from the blood into the muscle cells, and of course the blood sugar will go down. Simple, right? Next, we have another hormone which is also produced by the pancreas. This is called glucagon. Glucagon has exactly the opposite effect of insulin. Its major function is to cause the blood sugar to rise up. So under what situation do we need a rise of blood sugar? Like in a fasting state, if you're not eating for some time, your body has to utilize sugar as the fuel to generate energy. So if the blood sugar is going low, glucagon will be released by the pancreas. Glucagon will extract sugar from the liver and the blood sugar will go up. The third hormone is called incretin. Incretin is secreted from the gut. When you eat something, your food goes into your digestive system, it will cause the relief of incretin from your gut. Now, what are the functions of incretin? This is closely related to insulin and glucagon. In very simple terms, incretin will amplify the effect of insulin. At the same time, it will also reduce the effect of glucagon. If you have stronger effect of insulin, your blood sugar will go down. Then what about glucagon? The function is to raise up blood sugar. Incretin will tend to reduce the effect of glucagon. There's a tendency for blood sugar to go down. So in summary, the effect of incretin, the net result would be a lowering of blood sugar. I hope it doesn't sound too complicated. Now, other than this hormone, the body can get rid of excess glucose through the kidneys. There are some ways that the body can instruct the kidney to lose more sugar in the urine. It follows that the blood sugar will go down. Now, there are some medication which increase the release of insulin from the pancreas. The basic pathology of diabetes mellitus type 2, it is the adult onset kind of diabetes. The underlying problem is insulin resistance. Insulin resistance literally means the devaluation of insulin, just like devaluation of money. The problem is that the function of insulin is not as good as before. For instance, normally you need this bit of insulin to bring a certain amount of glucose into your muscle cells. Now, if one has diabetes, you need to have that much of insulin to bring the same amount of glucose into the muscle cells. Some of the medication we use to control diabetes will be squeezing your pancreas to secrete more insulin. But sometimes if you ask your pancreas to overwork for a long time, it will go on a strike. It cannot secrete more insulin. Then in that case, what will you do? If all you have is £1, but you still want to buy a £2 hamburger, what are you going to do? Another way you can do is to lower the price of your hamburger in order to control your blood sugar. If you cannot secrete more insulin, and your insulin is losing its function, another thing we can do is to increase the sensitivity of your tissue, of your muscle cells. There are some medications which can render your muscle cell more sensitive to the effect of insulin. That is to say, your muscle cell after taking those medications just need a little bit of insulin and a lot of blood sugar will go into your muscle cells. You get what I mean? The last way that we can lower blood sugar is to reduce the absorption of sugar from your gut. When we eat something, the carbohydrates in the food get broken down and absorbed into our blood. We have some drug to reduce the absorption of carbohydrate. That way it will lower our blood sugar to a certain extent. Well, I've discussed all the tools the body can use to control blood sugar. Next, I'm going to discuss some of the very traditional medication for diabetes. The first one is called metformin. It's very commonly used. It works by blocking the release of sugar from the liver, and at the same time it will also increase our tissue sensitivity to insulin. That is to say, just a little bit of insulin will be adequate to bring a lot of blood sugar into our muscle cells. It's a very good drug, although it's a bit old. It's very safe. The most common side effect is like a bit of bloating, or like some people may have diarrhea or vomiting. These side effects can be avoided by increasing the dose of this medication slowly. One of the shortcomings of this medication is that if some people have poor kidney function, it is not suitable. Another traditional medication is called sulfonylurea, and one most commonly used example is called diamicron. This medicine works slightly differently than metformin. It tends to increase the amount of insulin from the pancreas. When insulin goes up too much, it causes low blood sugar. The typical symptoms of low blood sugar will be shaking of hands, sweating. In the elderly, it can cause confusion or even loss of consciousness. It can be dangerous, so we generally do not recommend using this medication in the elderly. And sulfonylurea also causes weight gain in some people. Weight gain is undesirable in diabetes because it will make insulin resistance worse. I think it's about it in this video. I will leave the discussion of some newer generation of diabetic medication to the next video. Thank you very much for watching. I'll see you in the next one. Bye bye.